welcome to Front and Center, hosted by me, Patrice Charlotte, Communication Specialist for Equity and Community Health. Today, I'm joined by Drs. Peter Masiakos and Dr. Chana Sacks, co-directors of the MGH Gun Violence Prevention Center. Before I turn things over to our presenters, as a reminder, we do encourage comments and questions, and we'll have a dedicated Q&A at the end of the presentation, should time permit. We do ask that you save questions until the end and submit them by using the Q&A button located at the bottom of your window. Should you have comments, please feel free to put those in the chat. And with that, I will now turn things over to Dr. Chana Sacks to get us started. Chana?
Thank you so much, and thank you so much for having us here today. My name is Chana Sacks. With Peter Masiakos, we're the co-directors of the Center for Gun Violence Prevention here at Mass General, and we're glad to be here to share some of our work with you. But as we get started, what Peter and I want to acknowledge as we get started is that everyone listening today brings their own experience to this issue. Discussions about violence and gun violence specifically can be deeply personal. They are for us, and I think it's probably true for many people watching today. So we just want to invite anybody who needs to step away at any point during this conversation, or please reach out to us afterwards if we can be here and helpful to you. This week is a reminder that gun violence is in the headlines almost every day in this country. We see headlines like these: the brutal tragedy that we've all borne witness to in Nashville at a school. Headlines like these reminding us that in this country, in this year, it's only March, and we've already had more than 100 mass shootings so far in 2023. And headlines like these in the Boston Globe, reminding us that this isn't just some problem elsewhere. This is a problem. Gun violence is a problem right here in our city. Gun violence is now the leading cause of death among U.S. children and adolescents, the leading cause of death. It's now surpassed motor vehicle crashes, surpassed other heart disease, cancers, #1 in this country. And we don't just want to spend our time today on these statistics, but we really want to spend some time sharing with you the way we think about this issue and why we feel like there's so much more that we can do. First of all, and I think some defining terms and making sure that we're all on the same page is really important as we begin this conversation. Firearm-related deaths, gun violence, is often talked about in the media or the national narrative as if it's one thing, and it's not. There are those mass shootings that we just talked about that sometimes grip the headlines, like what we saw this week in Nashville. There are accidental, so-called accidental or unintentional injuries where, say, a 5-year-old finds an unlocked and loaded gun and shoots a sibling or a neighbor. There's law enforcement involved shootings. There's other forms of homicide and other forms of interpersonal violence that disproportionately affects communities of color. That's true right here in Boston and around the country. And then there's the least discussed form of gun violence, suicide. But when we look at the data, when we look at the numbers, it really looks like this: that these public mass shootings that so often stop us in our tracks temporarily and really dominate the national discourse account for less than 1% of all gun-related deaths in the United States. Accidental shootings, about 2%. Law enforcement involved shootings, 1%. Homicides account for 40%. Other homicides account for 40%. And suicide, again, the least discussed form of gun violence, accounts for the majority of all gun-related deaths. Time and time again, the work that Peter and I do in our center here at Mass General, the work that we do in the city, at the state level, is always grounded in community. And we think it is so critical that people whose lived experience, who have lived experience in this space, are at the table, are centered in this conversation about how to move forward here. And far too often that is not what we see. Far too often we just see sensational headlines about gun violence. Far too often we hear or we're told that Boston is one of the safest cities and one of the safest states, and gun violence isn't a problem here. But that would be a surprise to so many living in communities across our city that are affected by this issue day in and day out. And so Peter and I, as co-directors of this center, really ground our work in a central question. That is, what would happen if we centered the voices of those who are most affected by gun violence? And what do we mean by that? We mean that when we work with community partners, we hear time and time again that we need to change the narratives of gun violence. We need to change what people think about when they think about gun violence. We need people to really understand the ripple effects of these injuries, not just of somebody who is shot and dies, But people who are shot and survive, those become our lifelong patients. The trauma, the ripple effects of trauma extend to families, to friends, to communities. And we're not doing nearly enough to combat that and to provide the resources that we need for healing and prevention. So how do we transform narratives? I would say Peter and I are very good at knowing when something's right in our skill set wheelhouse, and we're really good at making the team bigger when we need more skills at the table. And when we're talking about media and transformative change and community-centered work, we reached out to an incredible partner at Emerson College, one of the world's leading colleges in arts and journalism and media is right here, just across the common from us. And joining with Emerson College and joining with the Louis D. Brown Peace Institute, which is an incredible organization that's based in Dorchester that seeks to support families affected by murder right here in our city, we have formed a multi-year collaboration called Transforming Narratives of Gun Violence. I want to share with you a short video that shares some of this work. You can get this to play. There it goes. But right now, this work is grounded in the idea that bringing together partners in the classroom in a very different way.
That's not our Boston.
That's not our Boston.
Esto no es mi Boston.
Este não é meu Boston.
That's not my Boston. C'est pas Boston pour moi.
That's not my Boston.
Our children don't deserve to be killed. They don't deserve to be shot down.
For every person shot by a firearm, at least 10 immediate family members are impacted. Repeated gun violence and the systems that perpetuate it lead to trauma for individuals, families, and entire communities.
Child dies in the emergency room from a gun wound and nothing happens.
Coming into the hospital and somebody making a cold remark like, which one are you here for? Because there were multiple people who were shot that night.
To make that John Doe or unknown male a person, right?
How is it that journalists are covering these stories and are choosing these sensationalist headlines instead of in-depth reporting? How is it that policymakers are making decisions about how to allocate funding without really understanding the voices and the stories of the communities whose policies are affected directly by this?
We are a community
of storytellers.
Lifting up the voices
of those most impacted by
gun violence in our city.
Every day in Boston, neighbors are coming together to support one another.
For individuals like me, who were formerly incarcerated, we do commit to the uphill journey of building a new life and paving new pathways for those who will come after.
Transforming Narratives of Gun Violence is a collaboration between the Engagement Lab at Emerson College, the Center for Gun Violence Prevention at Mass General Hospital, and the Louis D. Brown Peace Institute. Through co-created documentary, interactive and immersive media, games, journalism, theater, and more, we are inspiring solutions and interrupting cycles of violence by focusing on what people have, not what they lack.
Social Impact Studios are semester-long experiences at Emerson, where students and faculty work alongside community members to understand the roots and impacts of gun violence narratives in the media, so that they can create new ones.
The initiative is guided by a collaborative leadership team, including members of community organizations, doctors, elected officials, faculty, and students. The leadership team guides, amplifies, and distributes the narratives we make together.
To healing, to peace, to sustainability. What are we transforming to a better community?
Peter, I'll turn it over to you to share more about what this narrative is and introduce us to one of the classes that's been going on this last semester.
Thank you, Chana, and thank you, Patrice, for having us today. And in such a timely place in our history in America, where we're recounting 6 lives that were lost a few days ago in Tennessee, but the hundreds of lives that are lost every day, as Chana pointed out, in other places and even near to us. We felt, as Chana has said, that it is important to learn, and it is important to learn from the perspectives of others. As a trauma surgeon, I can tell you how to take care of bullet wounds. I've been trained by people who were trained in war zones, and we as a community of surgeons have been able to do this well. But are we really doing service to our community by just addressing the wounds that are time sensitive, but these wounds last for a lifetime in our patients? So, as Chana said, we walked over to the Emerson College a few years ago to learn a little bit about what they can do in the classroom and in redefining the narratives that some of our now community partners bring to the table, a table which for many years they haven't even been invited to. And we have started this program about 2 years ago. There were 3 classes that were picked to begin the project: a journalism, a media arts class, a theater class, and a visual and media arts class. And the idea here was to bring students from Emerson together with our community partners as educators, as co-creators of content. And the first class, which we'll show a little demonstration of, was designed to take the very difficult meeting between physician and mother of a dead child and give the perspective of the mother who's receiving the news that I've given so many times over my career. And the news that I give is heartbreaking, of the death of a child. And I'd never been trained to do it. And so what I've learned to do is based on what my educators have told me that I should do: get the news and get out. And we've learned so much from the mothers who are receiving the news, as you'll see in this trailer, which is a little bit of a prelude to the prelude of our documentary that was made in the first documentary filmmaking class called Quiet Rooms.
Thanks, Peter. And just to provide that context, as I'll hit play here in a second, but every course now happening at Emerson has Emerson students, Emerson faculty, and each one is paired with a community partner. And it's not kind of the usual academic community relationship that we see too often, where people drop in for 40 minutes and that's it for one talk, and then it doesn't build from there. No, in this case, survivors, as Peter is saying, take and teach these classes alongside Emerson students and faculty. So here's the documentary film course, as Peter was saying. They created this documentary, and here's just a trailer from it to give you a sense.
It's a room. It's got a chair in it, it's got walls in it, it's got art in it, and it's designed to isolate. Takes the family away from everything.
I couldn't see or hear anything. I don't know how long I sat in this room, but it was the most cold, unwelcoming room I've ever been in my life.
I'm gonna tell you my story before someone else tries to tell it. Does that make sense? And when you tell it, you heal, right? When you tell it and it's authentic and it's truth, you heal.
We just need a safe and neutral space for that to happen without judgment. And that's what Santre Wordplay did for me.
In order to build strength or build anything that you want, you need tools.
We all have what's within us, the innate ability. We all have what it is that we need to heal.
And these classes are remarkable classes. And one of the most special times in my week have been the weeks that I've gone to teach alongside of the students and the educators from the community. And I consider everybody to be teachers because we're learning from one another. The concept of research is based on outcomes, and learning about how we are doing is something that we're going to do going forward with our community. But just to give a little perspective of what's happened since we've begun this, we've taken this video to very different places around the city, around the state. The city council has seen it. The prison systems have seen it. Clementina and Eric have gone out to MCI Concord and showed the video to incarcerated students and incarcerated members of our community. And most recently, hospitals are seeing it too. So we're getting a little bit of information from the perspective of mothers, survivors, students into the medical community. The community is now being given credits as teachers, as students in this course, and there's a wait list to get into the classes at Emerson, which to me seems to say that it's working. And we are moving forward. We have a journalism class going on now, and we're looking at incorporating some more community members, teens, teen groups, veterans groups into this project. And I'd like to end our time today by plugging the Mother's Day Walk for Peace. This is the 27th annual walk that happens on Mother's Day, so everybody can remember it's happening on Mother's Day again this year. And it's the fundraiser for our community partner, the Louis D. Brown Peace Institute, that has impacted so many lives for so many years in maintaining a place of peace and hope and partnership within the community that's most affected by gun violence in our city. I'd like to invite everybody to join. This is the QR code for a donation to Team MGH. And please consider a donation for this very, very good cause and for a very, very strong partner in this project.
We all walk together, so really invite anybody who wants to join this team and be with us. It is one of the most incredible events in the city every single year, and this will be no exception. We're joining together. We're fundraising on behalf of Team MGH for the Louis D. Brown Peace Institute, but we'll be joining with hospitals across the city and all walking together, and it's just an incredible part of the year. So please join us for that. Well, Patrice, we'd be happy to turn it over. We want to leave plenty of time for discussion and for Q&A. So thanks again for having us, and we'll turn it back over to you.
Of course. Thank you both so much for an incredible, eye-opening and moving presentation. I would like to open things up for Q&A. So as a reminder, please just hit the Q&A button at the bottom of your window if you'd like to submit a question. We did receive a couple of questions beforehand, so we can just dive right in. Would love to hear from both of you. What is your long-term vision for this work, for the courses? Where are you hoping that things will go?
It's such an important question. And, there's some projects that you start, you know exactly where you're headed when you start. This isn't one of those types of projects when we're talking about this, the transforming narratives of gun violence collaboration. We started by saying, let's bring all of the right people who have never been in rooms together, not often enough have been in rooms together, bring the right people to the table and see where that leads. Because we can envision impact in so many different areas. We can envision in our journalism courses changing the way that journalists and reporters tell stories about gun violence. We've heard time and time again from our community partners that the media only shows up in their city, in their part of the city, on their worst day. They show up, they write stories with these sensational headlines about this person shot, and then they leave and aren't telling the story of resilience, of rebuilding, of healing, of what comes next. So we're looking to tell those stories and really change those perspectives. We're looking to change the way that we deliver care in the hospital. How do we improve our trauma-informed approach? How do we center the voices and the experience of people most affected and let them tell us how could we have supported them better in the moment, in the worst moments of their lives, when we are so privileged to meet them and try to help them through that worst moment? How do we do better for them? So I think across the community, across the institutions in our city, as Peter mentioned, from city government to media, to us and right here in the hospital. I think in each of those facets, there's a vision and there's room and there's so much work to be done.
And what we've heard is that we feel that the people closest to the problem are the ones that are closest to the solution. That's true of healthcare, that's true of the community educators. But for Boston, it's unique to Boston, and there are other cities around the country that we feel that we can have impact as well. And in fact, we are organizing actually a group of similar-minded folks from around the country, California, Chicago, Philadelphia, to see if we can scale this program to fit their narratives and their cities, because the cities are not the same. And the people who are experiencing violence in those cities are not the same. And so in anticipation of an event sometime at the end of the summer, beginning of fall, we'll bring people together from those cities to start talking about scaling this program.
Thank you. So Chana, you talked about bringing people together, people who often don't have a seat at the table. What has been the impact of that? What has been your proudest moment? What have you seen in bringing these groups together?
There have been so many, and let me share maybe a couple. I think that one of the things that's the most powerful is the relationships that have the opportunity to build, and the trust that can build over the course of an entire semester of work together. So often, if most courses are designed with, you have a guest speaker who comes in for 45 minutes, gives one lecture, and that's the end of it. It's not a bidirectional conversation. The work isn't being done together. And when we had one of our first, the journalism course to create, the documentary film course that created Quiet Rooms that you saw the trailer to, at the beginning, there were mothers whose children had been killed from gun violence in our city were in this course. And at the beginning, one of them spoke very little in the class. By the end of the course, was speaking, was bringing everybody together, and was a leader in the class. Another person who I have learned so much from at the beginning of the class told me that every time that she would try to tell her story, she found herself getting angrier and not even being able to tell the story in an effective way. Now she tells me that she's a film producer, which she is. Now she tells me that she learned tools through that class in order to be able to tell her story better. And I think just those two moments of hearing those stories from people who gave so much of their time to teach and take these classes alongside Emerson students and faculty, to hear from them the skill sets that they felt like they gained, and the ability to tell their stories better, and as you heard in that film, more authentically, to be able to tell their narrative and their story. And it goes all directions. That has changed Emerson students, changed those from our center who have been taking these classes alongside Emerson students and faculty and our community partners. And I don't think anybody has come out of any of these courses unchanged.
And people are coming back. The students who are enrolled in the first classes are now taking their third class. And the school is offering a minor in this work. And as I said, the community educators are being offered credits that are transferable. And many of them have gained multiple credits. And there's one particular formerly incarcerated student now that's going to graduate from this program. And if that's not an outcome measure, I don't know what is. And it's really 3 short years from the beginning of our relationship with Emerson to really turning away professors who want to run these classes. That's where we are. And it is an astounding moment when the two suspicious parties in the room trying to feel each other out and see what the other's about, all of a sudden mingle and co-create and produce a product that when you get to see this video, every time I see this video, the Quiet Rooms video, I learn something new, and everybody who's seen it asks us how they can do something similar to what we're doing here.
And maybe we should just say that explicitly. If you go to transformnarratives.org, all of the media outputs of each one of those courses, again, this documentary film course is one of them, but the media outputs of every course is freely available, and we invite you to watch it, to use it, to share it. So
to become involved, to join us.
Absolutely.
So speaking of involvement, you mentioned the Mother's Day Walk for Peace. Can you talk a little bit more about the walk and tell us and those on the call what we each maybe can do in our own lives to get started on this journey?
I think as any big journey starts with the first step, we mean that both figuratively, but in this case, we mean it literally, concretely. Like, come take these steps with us. There is nothing like showing up. When you're wondering what you can do, when you're watching these headlines and watching the news stories unfold and feeling helpless, one of the biggest challenges that I think we face is helping other people and reject the learned helplessness around this issue. So often, too often, people think about this problem and the magnitude of it and how big, of course, it is, and think there's nothing that we can do. Nothing's going to change. And you can't feel that way when you show up at this march. You can't feel that way when you scan that QR code. I'd be happy to share it again. Come join our team. Realize you're not alone with those complex feelings, emotions, experiences, that you have a community that wants to take this work on together and do it together and walk side by side to support the Louis D. Brown Peace Institute, to support making our city a safer place. It really is something concretely that you can do. And I really invite you to be a part of it. And I dare anyone to join us for that day and not feel empowered and more engaged to take the next step after that.
And as someone who actually has completed the walk myself, I can absolutely echo those sentiments. It is so moving and it is so transformational. I absolutely am a different person since doing that walk. So to anybody on the call who's interested, please do it. And we can definitely put the link in the chat, put the QR code out there again if you'd like to donate or participate. So last question to both of you. What is the key takeaway? What do you want the people on this call, the people who are watching this video later, what do you want them to know? If you could each share something, what is that?
I'd like to say that despite the narrative that nothing has been done for so long, so much has been done for so long. We have so many partners here and so many interested people with different perspectives and different approaches and different interests. But our mission is the same. We're all focused on mitigating gun violence and violence around us. And I think that there's no better feeling than to see people with common interests coming together and different interests coming together to do something impactful. And our community members are telling us that what we're doing is impactful. And the fact that we have more to do keeps us going. And I think showing up, if anybody is interested, please do.
I think my biggest takeaway that I would ask people watching and listening to walk away from this session with is to recognize that to work to end gun violence is not a fight that just belongs in Washington, D.C. This is not, yes, there are political elements to this, of course, and yes, there needs to be change. There needs to be policy change, but there is so much that we can do right here where we live, where we work. And I think that opportunity to really reflect in our lives, whether that's clinically, our lives in the hospital, whether that's in our community right here in our city, there is more we can do. And we have the opportunity to do it together and do it in community. And we'd be so grateful if you want to join us.
Awesome. Well, Chana, Peter, thank you so much. Thank you for all that you do, and thank you for joining us today. That concludes today's Front and Centered. Thank you, everybody who attended. Our next Front and Centered will be in May, and more details to come. So in the meantime, please do stay connected with this work and reach out to us if you have any additional questions. Until our next one, please take care. Bye, everybody.
Thank you.